Oh, welcome, welcome. It's 7 o'clock, so I'm going to go ahead and get started right on time. I know we probably have a few more people going to tune in here, but let me go ahead and introduce myself. I am Dr. Jennifer Stagg. I am owner of Whole Health Wellness Center. We're located in Avon, Connecticut. If anyone's familiar with that area, we're right out next to the Wellness Center in Avon on Route 10 as you head up to Simsbury. We've been there for, oh my gosh, close to going on, let's see, we opened in 2006. So what's that, 15 years now we've been there. I'm a naturopathic doctor. My husband, co-owner is a chiropractor, certified chiropractic sports physician and acupuncturist. And then we also have two other naturopathic doctors on our team, Dr. Ayla Clark and Dr. Karen Bender. Our approach to medicine is one of integrative care. So we work together with a lot of your other healthcare providers. Many of our patients that come in have other specialists, primary care providers. We are recognized as specialists in the state of Connecticut. So a lot of insurance companies will, recognize us as specialists, and we do accept many insurance plans. So we're contracted and in network with many insurance plans. The majority of our patients do come in and use their insurance. Occasionally there are some exceptions to that depending on the plan you have, but we believe in making healthcare accessible as well. So with that, let me get started and dive into tonight's topic. What we're going to cover tonight is focused on the thyroid gland. We are going to cover thyroid function, thyroid disorders, define what those are and how prevalent those conditions are. We're going to talk about underlying causes of hypothyroidism. So many of you tuning in may already have an issue with your thyroid gland, or you may be suspecting you do. We're going to talk about signs and symptoms of hypothyroidism. We're going to also really talk about lab testing. And then, of course, we'll let you know how to book an appointment at our clinic, or also you could just do a free discovery call first if you're not sure if this type of medicine is for you. So hopefully my audio has been okay. I forgot to check in. Bridget, if you are listening here, I think you are on here. Let me know if my audio is okay here in the chat. I'd appreciate that. Yes, great, excellent. Okay. Let's get into thyroid function. So thyroid hormone, hold on, let me get that slide back. Okay, thyroid hormone is the hormone released from the thyroid gland. It's essential for life. So without thyroid hormone, it is a necessary hormone. We would die without thyroid hormone. So it's vitally important. Now, sometimes these levels get low, but if it is extremely low or certainly absent, we're in big trouble. So many different functions are the result of thyroid hormone. We'll go over those here in a second. Every single cell in your body has a thyroid receptor. So thyroid hormone binds every cell in your body. So it tells us how important it is. It's really important in metabolism. So I know I was checking out the chat here, and a few of you weighed in on belly weight and fatigue. So when we think about metabolism, thyroid is really important. And when we have patients that present with concerns about weight management, that they've gained some weight, we definitely want to check out thyroid function and do the right sorts of tests to make sure we're not missing anything related to the thyroid, because that can affect your metabolism, your ability to maintain a healthy weight, burn calories at an effective rate. And it also is really important for energy levels. So a really common complaint that we get from our patients that come in is fatigue. And of course, we're going to really evaluate and check the thyroid gland's function on blood work. Thyroid hormone, as said, metabolism, also important for energy, but also basic functions like breathing, your heart rate, your nervous system, musculoskeletal health. So I will go over symptoms of thyroid disorders, but for some people it's aches and pains, aching muscles is a common complaint that we'll hear in people who have thyroid issues. Also just like weakness, that even sometimes I'll have patients complain that they can't open jars very well anymore, or just lifting their coffee cup seems to be, presenting with some difficulty, and that would be a sign to definitely check for thyroid function. It's really important in reproductive health as well. So when patients come in again with a complaint of difficulty with getting pregnant, or issues with miscarriages, repeated miscarriages, thyroid function is important to check out. Body temperature, this is a big one as well. Regulation of overall core temperature, your appetite, digestive function, some issues with cholesterol and triglycerides. Again, we'll get into that a little bit more, but also just regular physical growth and mental development in children. Thyroid hormone is really important there as well. So that is something that's checked in every newborn, because it is so vitally important that that's on one of the groups of blood tests that's done in the hospital when the baby's born. So how common are thyroid conditions? We do see this quite a lot in our clinic, and about 12% of the US population will develop a thyroid condition at some point during their life. Now, the biggest problem I would say that we encounter with thyroid disease is that the majority of people aren't even aware that they have it. So obviously, if you had something going on your skin, you have it, right? Like, it's pretty obvious. You might know exactly what disorder it is, whether it's eczema or psoriasis or some sort of dermatitis. But when you have a thyroid condition, because there are so many different symptoms, and some of these symptoms can be vague, like, aches and pains or fatigue or weight gain, then it can often go undiagnosed for a long period of time. And sometimes people don't really have a lot of symptoms either. Sometimes the symptoms are really classic. And of course, a patient we need to actually come into a healthcare provider's office and do routine screening. That's typically done on an annual physical, one of the tests for thyroid, and we'll get more into thyroid testing if there's a screen that's done. But if you're actually, having some symptoms, it's really important to talk to a healthcare provider about those and make sure that the proper tests are done. Now, the majority of what we see is hypothyroidism, and we'll talk about the exact conditions here. But hypothyroid means low thyroid function, and it's the second most common hormone or endocrine disorder that affects women premenopausally, next to PCOS. And we offered a webinar last week on PCOS. I don't know if anyone here tonight had the opportunity to listen to it, but it was a fantastic webinar that Dr. Clark hosted. And just keep your eye out for other webinars. We do quite a bit of these. It's really important to us to educate about health conditions. So the most common cause of hypothyroidism in the US is something called Hashimoto's, and we'll talk quite a bit about that tonight because it is so very common, and a lot of people don't know that they have it. So many people will come in and they know they have hypothyroid, that they may have been diagnosed with hypothyroidism, low thyroid function, but they may not have ever been tested for Hashimoto's, and that's a specific type of blood testing that's done to check for antibodies, which is diagnostic of Hashimoto's. This is 5 to 10 times more common in women than men. So, I've had clinic days where I've seen 3 out of 4 patients with a thyroid condition, Hashimoto's being the number one for sure. Now, other thyroid disorders include hyperthyroidism. That's an overactive thyroid gland, and most of that is caused by a condition called Graves' disease, and that is an autoimmune condition. So Hashimoto's is autoimmune, Graves is also autoimmune. Now, with thyroid conditions, these can get complex. Hashimoto's can sometimes fluctuate around in terms of thyroid function, where sometimes it can be high, sometimes it can be low. Graves' disease can also kind of fluctuate, and sometimes you can see the antibodies lower and see the thyroid TSH level come down. We'll talk about those tests in a second. But with all of these conditions, it does require, close follow-up, close testing, again, checking the right tests. Some less common thyroid disorders are thyroiditis. So this is basically inflammation of the thyroid gland, and that can happen for a variety of reasons. Postpartum, after pregnancy, 5 to 9% of women are affected by this. Acute, subacute, drug or even radiation-induced thyroiditis. A lot of these different forms of thyroiditis can be temporary, but they can be very severe and require really intensive management with an endocrinologist. Sometimes patients can have something called a thyroid storm. That again is less common, but there are many different thyroid disorders. As I said, the most common that we see is Hashimoto's and low thyroid function. So that's mostly what we'll focus on tonight. Now, there are other conditions like congenital hypothyroidism, meaning you're born with it. That's, as I mentioned, an important test that's done in the hospital when babies are born. Some people can have thyroid nodules. This can be common in patients who have Hashimoto's. And sometimes we can feel these on an exam. Sometimes that's what will trigger testing, doing an ultrasound on the thyroid. If your doctor is checking your neck, they're typically checking lymph nodes, and then we're checking the thyroid gland to check texture and check for size to see if we see nodules or masses. And of course, checking those lumps out, making sure we're not finding something like thyroid cancer, which can be certainly quite severe, and it can be picked up on just a general physical exam. And then there's also something called a goiter, which maybe many of you have heard before, but goiter is an enlargement of the whole thyroid gland, and that can come from a variety of different causes. But these thyroid nodules, goiter, thyroid cancer require imaging of the thyroid gland, specialty management. Many of the thyroid nodules are benign. So when we do find thyroid nodules, which are pretty common, as I said, when we do find them, depending on the size of them, depending on the characteristics that are listed on the imaging report, then that will determine what sort of management is done. So if a nodule was larger, need to be biopsied using fine needle biopsy, and that would be done, in an endocrinology office or interventional radiology. It's quite uncomfortable, but it's necessary to do to get some of those cells out and check the thyroid to make sure, none of those cells are cancerous. The majority of the time, those nodules are benign, non-cancerous, but they do need to be monitored over time to make sure you're not seeing a lot of growth with those nodules, because they could potentially become cancerous. And that's why they're monitored, make sure that they're stable over time. So, risk of thyroid disease. There are a number of different factors that can increase the risk of developing thyroid condition. So if you have a family history of thyroid disease, that can increase your risk of having a thyroid condition. So, that is something that's often checked on any sort of medical exam, and history is asking about family history. If you've had relatives who have had thyroid disease, that's important information for your doctor to hear. Also, if you have certain medical conditions, you could also be at risk of developing a thyroid condition. So type 1 and type 2 diabetes, pernicious anemia, that's a very specific type of anemia. Another endocrine or hormonal disorder of the adrenal glands called primary adrenal insufficiency puts people at an increased risk of having a thyroid condition. And then some autoimmune conditions like lupus, rheumatoid arthritis, Sjogren's syndrome, and then a genetic disorder called Turner syndrome. If you're taking a medication that's really high in iodine, that can pose some risk for thyroid disease. Older than 60, certainly, many women before menopause will present with thyroid conditions. Again, as I said, it's more common in women, but as we get older, then also that increases the risk of being diagnosed with a thyroid condition, any of those that I listed before. And then, of course, if you have had a past thyroid condition and it had become stable, so if you were someone who had an issue after pregnancy or was on thyroid medication in the past and then, normalized and you were taken off of it, or if you've had cancer, or, radiation, that could increase your risk of having a thyroid disorder. So that's something to watch out for over time. So let's get into some of those symptoms here next. And if you have any questions, you can put them in the chat. I'm just going to answer those as we go through. I haven't seen anything come in here yet, but if you do have some general questions, I can't answer really specific questions about your, personal medical history or give you any advice, unfortunately. But if you have general questions about thyroid, I'm happy to answer those as we head through here. And hopefully I'm covering a lot of it for you anyway. So let's get into some of these symptoms. I just put in a bunch of pictures here that hopefully not too many of you can identify with all of them, but maybe some of you are identifying with a couple of these. So this little pup here, totally exhausted. Now, because as I mentioned, you can have a thyroid condition and have some of these symptoms. Some of these symptoms, though, could be something else. So being fatigued and exhausted, that could be your thyroid, but it could be something else. And that's the importance of doing the right sorts of tests to determine what's actually causing that fatigue. Let's see our next one. Okay, stressed. So just overwhelmed. And that can come from thyroid disease as well. Let's see the next one I put in here. What's this one? This is weight problems. So I know, again, for any of you joining me a little bit late here, we talked about, there were some messages here in the chat about people concerned about stubborn belly weight and metabolism, and thyroid can be a factor here. So if you've been gaining weight kind of slowly over time, sometimes even rapid gain of weight can be a thyroid condition. Typically, this is more on the order of 10 to 20 pounds, which can be significant. If you've gained a tremendous amount of weight, more like 50 pounds, 100 pounds, then that's not all thyroid. A portion of it could be, but it's not all thyroid. Let's see, the next one we have here, thinning hair. This is a tough one. A lot of women can have issues with thinning hair, or men as well. Portion of that can be thyroid. It could be other hormones involved there. It could be nutritional deficiencies. Again, many of these symptoms with the thyroid can be confusing because it can be other conditions. Being quite cold, so cold hands, feet, cold core, that can be a sign of thyroid, low thyroid, a hypothyroid condition. Issues with going to the bathroom, bowel irregularity, constipation, that's one of the symptoms of hypothyroid. On the other side, hyperthyroid, we can sometimes see diarrhea or frequent bowel movements with that. Pain is another concern that we see patients presenting with when they may have a thyroid condition. So, aches and pains in the joints, in the muscles are an issue. Let's see, there was a question here about nodules being related to Hashimoto's or Graves', or is it just nodules? Hashimoto's commonly can have nodules associated with it. It's not diagnostic though. So nodules can just be nodules on their own. And so some people who have nodules don't have like a diagnosed condition as just nodules. So they may not even have hypothyroid or an autoimmune condition. It can just be a nodule or multiple nodules. And let's see, this is, I think, the last symptom slide I put in here for pictures. This one, depression, is what I'm getting at here. So Low thyroid function can also present as poor mood, what we call dysthymia, a mild, reduced, like low or negative mood can be associated with or caused by low thyroid function. Here are some other symptoms that can be related to hypothyroid and can be explained by a low thyroid function. Dry or thinning hair we talked about. So also just like a change in texture in your hair. Sometimes I'll have patients who come in and their hairdresser maybe has commented on some changes with their hair. Fatigue, we talked about depression, mild depression, cognitive impairment, sometimes issues with what, people will refer to as brain fog, memory issues can be thyroid, hoarseness of the voice. So a lot of times we see that when there are changes in the size of the thyroid gland or potentially a nodule. Enlarged thyroid gland. So now these are all symptoms of hypothyroid, not just general thyroid disease. We're focusing on hypothyroid here, just to be clear. Dry skin, low perspiration. So sometimes that's a complaint I hear, I'm not sweating anymore, or my heart rate is lower. That's bradycardia. Cardiovascular disease can have a hypothyroidism component to it. Patients who have elevated LDL cholesterol, what's known as bad cholesterol, it can be the result of low thyroid function. We talked about weight gain and difficulty losing weight, constipation I mentioned. I did mention infertility and recurrent miscarriages earlier. Irregular periods, so skipping periods, sometimes heavy bleeding, changes in your period can be related to or caused by hypothyroid. We talked about cold hands and feet, peripheral neuropathy. So this would be, numbness and tingling in your hands or feet, high blood pressure, and we already talked about muscle aches, weakness. So these are a lot of the common symptoms. So you can see here that many of these could, you could have like only a couple of these, you could have a bunch of these. These could be from something else, but these are all symptoms that you can have if you're dealing with low thyroid function, hypo. So the hypothalamus is the where the whole pathway starts with thyroid function. So we'll just talk about how this actually operates through the body. In the hypothalamus, which is sort of a section of the brain, like lower brain, and that releases a hormone called thyrotropin releasing hormone. And that signals the pituitary gland, which sits at the base of your skull, to release TSH. TSH, for some of you who may already know, TSH is the hormone that's generally used for initial screening purposes, and it is the most important hormone to test for management to make sure the thyroid is functioning. It's a most specific and accurate indicator of thyroid function, very sensitive indicator. TSH stimulates the pituitary gland the pituitary gland releases TSH, which goes to the thyroid gland, and the thyroid gland is what releases your thyroid hormones, T4 and T3. Within the thyroid gland, there's an enzyme called thyroid peroxidase. I bring this up because I'm going to talk about testing. There's an antibody called thyroid peroxidase antibody that we test for to see if there's an autoimmune condition. But this is where that enzyme is in the thyroid gland. And what it does is it helps with the production of T4 and T3. T4 is the main hormone produced in the thyroid gland. It is inactive and requires conversion to active T3, which happens in other parts of the body mostly. And I'll show you that breakdown here in a second. This active form T3 is what's responsible for regulating, all those body functions that we talked about earlier on in the presentation. So here we are with the thyroid gland. T4 is mostly what's being produced in the thyroid gland. 93% is T4, 7% is T3. In the liver, 60% of the T4 is converted to T3. Now, some of that T3 remains inactive and needs to get converted to active T3 in the gut, like intestines, heart, muscle, nerves, there's conversion going on there as well. And sometimes when there are issues with problems with GI health, we can see some thyroid problems as a result of it. And that's something that's generally, not really discussed much in thyroid function. People always want to know, well, what's causing this? Sometimes we can find the cause, and these are some of the things that we look for: issues with gut health. And we'll get into more causes of thyroid, hypothyroid. Then 20% of what's released from the liver converted is this inactive reverse T3. Now, cortisol, as we start to talk about causes, cortisol is one of your stress hormones, the main one, and cortisol will decrease the amount of conversion of T4 to T3. It will also increase the amount of this inactive reverse T3. So that's another important factor to look into is cortisol levels, and stress is one of the most common causes of a thyroid condition. Even above that, I would say, or probably equal to that, is inflammation. So inflammation, you hear a lot about inflammation. Basically, it's just your body's natural protective immune response. In some conditions like rheumatoid arthritis, you can feel and actually visibly see what inflammation appears as. And so redness and swelling in joints, heat in the area, feeling pain. These are obvious signs of inflammation, but a lot of times inflammation is silent. Luckily, we can test for inflammation. There are blood tests to check for inflammation. Inflammation is a huge issue. We've done some presentations on inflammation. I think we have one coming up in a couple of weeks on inflammation. It's something I talk about a lot. Some of the causes of inflammation are stress, acute and chronic. So stress itself can affect the thyroid gland through the cortisol pathway, but then it can also have this effect through inflammation. Some people are more prone to inflammation because of genetic reasons. Poor diet increases the presence of these pro-inflammatory chemicals, and that can cause problems with the thyroid gland. So even dietary practices can be related to poor thyroid function. The upregulation of inflammatory signals as a result of changes in hormones, toxic exposures, pathogens, certain types of bacteria and viruses can cause turn on of these inflammatory signals. And there's good reason for that. There's an important protective reason for that. It's when it becomes chronic that it can cause problems. Now, inflammation, acute inflammation, can cause a thyroid condition, but a lot of times what we see is chronic low-grade inflammation, and that can cause a host of other conditions as well, not only thyroid, cardiovascular disease, Alzheimer's, even osteoporosis is thought to be have an inflammatory component to it. Sometimes people with inflammation, this chronic inflammation, there's difficulty kind of turning off this break this in the immune system, becomes chronic. And then we also see nutritional insufficiencies and various other nutrients found in food, lack of those in the diet being important for being able to properly control inflammation. So let's talk about some other causes of hypothyroidism. We talked about stress, we talked about inflammation already. Some of these levels, as I mentioned, you can see elevated levels of markers of CRP, ESR, which is the SED rate, IL-6. We generally don't check that on blood work. Some insurers will cover that, but CRP and this ESR or SED rate is routinely covered, and we can check to see if there's inflammation happening. That can be part of why someone is experiencing a thyroid, hypothyroid, or some other thyroid conditions as well. Nutrient insufficiency or excess. So these are some other nutrients that we also check out: iodine, selenium, zinc, iron, vitamin A levels are important. Not enough of those nutrients can impair thyroid function, impair the ability for the thyroid to make those thyroid hormones. While excess fluoride and too much iodine can actually damage the thyroid. So iodine is something that needs to be kind of just right. So you do have to be careful about too much iodine. Be careful about taking really high dose iodine supplements. There are also some medicines that contain iodine where people can have thyroid disorders because they're taking medicines. I think I have some information in here about that as well. Autoimmune conditions, Hashimoto's, I've mentioned quite a bit as a cause of hypothyroidism, and certainly autoimmune disease. A lot of what we see with autoimmune disease, there's an inflammatory component, changes with the immune system, many different triggers, stress, cortisol production as a potential trigger. Defective or no thyroid at birth, much less common. Failure of the pituitary gland to produce sufficient TSH. Some more causes of hypothyroidism, less common causes, endocrine disrupting chemicals like BPA, which we find in plastics, have been implicated in hypothyroidism. That's one example. We also talked a little bit about pregnancy, postpartum, having some issues with the thyroid, but some women produce thyroid antibodies during and after pregnancy, and that could lead to Hashimoto's or Graves'. Estradiol reduces iodine uptake and it increases thyroid binding globulin. So higher levels of estradiol can impact the thyroid. Here are some of those medicines that I talked about that could impact thyroid hormone function. And then also, if you're already taking a thyroid hormone medication, thyroid hormone replacement, certain medications can decrease the absorption of your thyroid medicine. So you do really want to be careful about when you take these medicines, make sure you're not taking them too close to your thyroid hormone. Even some supplements like iron and calcium need to take special care to make sure that those are not taken too close to your thyroid hormone. You really want to just take your thyroid hormone and take it away from, first thing in the morning is usually when it's recommended, away from food, and even coffee can reduce the absorption of the thyroid hormone in the gut. So if you're just joining us, if we have anyone else who just joined us, we have been talking about underlying causes of hypothyroidism that no one's talking about, uncommonly known signs and symptoms of hypothyroid, understanding the thyroid function, thyroid disorders we went over. Now we're going to go into lab testing. So thank you so much for hanging in there. We're about 7:30. We've got a little bit more to go, but I won't hold you too long. And again, if you have any questions, go ahead and ask them. I'll just answer them as we head through here. So thyroid function tests, the main one that's done is ordered is TSH. And what's considered to be mild subclinical hypothyroidism is a high TSH with a normal free T4. So that's kind of classic. Now, people who have like overt, more extreme hypothyroidism, the TSH level is usually over 10. I've seen these levels quite high. And we'll have actually a subnormal free T4. So the bulk of what we see is that are below 10, we'll get into optimal ranges here in a minute, but below 10 and with a normal T4, the bulk of definitely what we see is mild subclinical. The majority of T4 is bound up. So if you do a total T4, that's most of the T4. So a free T4 measures how much T4 is in the blood and available to cells. Now, again, that T4 needs to get converted, but still T4 is an important measurement to use in combination with the TSH because it can help us better define, where you are sitting with thyroid function. Free T3, we also order routinely for the most part, and it is more so used to diagnose hyperthyroidism, seldom used in hypothyroid, but we do find cases where patients can be on thyroid medicine, they're still not feeling the best, their TSH is normal, their T4 is normal, but they might have a low T3, and so that could be the result of some of these issues with conversion. As I mentioned, it could be related to high cortisol levels, some issues with gut health as well. The reverse T3, the trend with a reverse T3 tends to follow the T4 trend. And then really importantly, we do measure thyroid peroxidase, TPO antibodies, and thyroglobulin antibodies. And elevated antibodies can signal, obviously, autoimmune disease, but the majority of times it's Hashimoto's. Both of those hormones can show up in Graves' disease as well. And Graves' disease is the condition that I mentioned that is related to hyperthyroidism, over a functioning thyroid gland. Some other tests that might indicate hypothyroidism that you may, have on your blood work, routine blood work, elevated cholesterol, LDL especially, that we see can be the result of low thyroid function. So sometimes patients are coming in, their main concern is high cholesterol, and we're looking at those numbers. And we'll also check out thyroid function to make sure there's nothing going on with low thyroid function that could be causing this elevation in LDL. That's an important one to check out. Hyponatremia, which is your sodium levels, that's on a routine blood work. Low sodium could be the result of hypothyroidism. High levels of creatine phosphokinase, various, checking out anemia could be the result of hypothyroidism or related to it. Elevated, something else called lactate dehydrogenase, and then high prolactin levels too can be indicative of hypothyroidism. So those are a couple of other blood tests that are not diagnostic of hypothyroidism, but could be related to the fact of having a low thyroid function. Okay, here we go. So has your doctor ever told you that your lab work is normal and you still feel terrible? So we get this all the time where patients come in, they may be on thyroid medicine, or they've had some issue with their thyroid gland and they're not on thyroid medicine. They were watching weight and it's kind of okay, but they still feel terrible. We see this a ton, and sometimes it's related to actual thyroid range, so that it's listed with TSH. So TSH is that main, really specific test. Oh, I see here. Someone said yes. Anna said yes, that she's been told she's fine but feels terrible. We certainly get a lot of that. TSH optimal levels are between 1.0 and 2.5. Now, the issue is many labs list 3.0 as the cutoff for TSH. Other labs may list 4 or even 5.7 as the cutoff. So then your TSH is not flagged as being abnormal, and then you're told, oh, you're fine, you don't need to do anything. Or sometimes those levels are a little higher and still, and like in those ranges, even at a 4, you don't have to be on medicine. At a 5, you don't have to be on medicine. You may feel better on medicine, but there are also other ways that we address this and look for other causes like stress. And we always want to treat stress first, because stress can be causing this. So as naturopathic physicians, we look for cause always. These adrenal glands I was mentioning producing cortisol, these swings are typically caused by emotional stress, but it can be caused by physical stress as well. So injury, recent surgery sometimes could be a trigger for a thyroid condition because of adrenal function. Cortisol lowers TSH levels by resulting in decreased thyroid hormones. It blocks the thyroid hormones at the receptor sites, and it also lowers the conversion of T4 to T3. And as I mentioned earlier, increases the reverse T3. So when we're looking at thyroid function to really get a good understanding of it, in summary, the TSH is definitely a test that needs to be ordered. We also will look at free T4, free T3. These thyroid antibodies are really important to look at. Thyroid peroxidase, thyroglobulin antibodies, also something called TSI, or thyroid stimulating immunoglobulin, is an antibody that can be indicative of a hyperthyroid. Looking at nutrients, I've mentioned that in the presentation, iodine, an iron panel, zinc level, selenium, these are important in manufacture of thyroid hormones. So sometimes people could have, patient could come in and have low thyroid function and, wonder what the cause of it is, and they may have low iodine levels, common cause, and supplementing with iodine, nutritionally, sometimes with a supplement, sometimes through dietary strategies, can help improve that thyroid function. Checking out the inflammatory markers are really important. So the SED rate and the CRP, we talked about inflammation tonight. And then very, very important, checking stress hormones. Cortisol, we talked quite a bit about, but also DHEA is another one of those stress hormones that is important to check along with cortisol to see, you know, the balance there and get an accurate representation of adrenal function. So really important to choose the right tests and do the right test there. So if you're dealing with some of these symptoms or have been diagnosed with a thyroid condition, it's so important to make sure that the right tests are being ordered. And if you haven't gathered already, as naturopathic doctors, we're really trying to find the underlying cause and focus on those causes and not just treat the symptoms. Now, certainly patients could go on a thyroid hormone and you know, sometimes I'm recommending that, like, okay, I think it's time to take thyroid hormone, but we're also looking at these causes as well. Sometimes we can't find a cause. The bulk of the time we can. Stress, inflammation are the big ones that we find. Nutrient deficiencies, definitely want to get checked out for all of those. Then we correct those dysfunctions, looking at the body as a whole, minimizing stress, looking at, you know, what sort of support system you have at home, all of that. This is the way that we approach thyroid health and managing symptoms. Not, you know, we're looking for causes, not just like putting a Band-Aid on it and hoping just one symptom goes away. Really looking for underlying causes. It's so important to figure that out to get an accurate, you know, treatment and help you feel better. So if you're interested in speaking with us and potentially booking an appointment, you can do what's called a free discovery call. So you can call in, you can book a time. As soon as I get through the next slide here, the number will pop up and you can, or a different website's going to pop up and you can book a discovery call with one of our staff members and they'll help you navigate a plan of action. So let us know what you're going through, how our practitioner and support team can help, and help prepare for your first appointment and see if this is right for you, if we think that we can help you. And then if you're ready to schedule an appointment, you could go ahead and call our number and book your consultation with your new doctor. As I said in the beginning, if any of you missed it, most insurances are accepted. We do offer virtual and in-person appointments. The first appointment is a 1-hour comprehensive visit. We typically order blood work at that appointment. We may offer a little bit of treatment advice, but a lot of that visit is dedicated to better understanding your medical history and trying to determine the cause of what's going on. So thank you so much for sharing your evening with me. I really appreciate that. If you're interested in making an appointment for a discovery call, I'm going to pop that offer up here and you can go ahead and book that. Thanks so much for joining me and have a great evening.